hours is it's so important. And a lot of people don't realize that, well, physicians graduate with about 15,000 minimum hours of clinical experience. Nurse practitioners must complete a minimum of 500 clinical hours to receive a master's degree and then be able to practice as a nurse practitioner. For this doctorate degree that you talk about, first of all, 85% of all nurse doctorate degrees are non-clinical,
Right.
meaning they're learning leadership and computer skills and things like that. But for those that pursue a doctorate, they have to get another 1,000 hours of clinical experience. So we're talking about just a fraction. And just to compare that to some other professionals, to become a cosmetologist, to put, do hair and makeup and fingernails on people, you have to have like 1,500 hours. So you can have less hours graduating to be a nurse practitioner where someone's life is in your hands. And so now we're seeing, well, they can do these residency programs, or sometimes they call them fellowships. And a lot of physicians get a little annoyed when we hear that, because we remember our residencies and fellowships, they're extremely competitive, they're long hours, they're grueling. And the nurse practitioner ones are more like kind of a 9-to-5 job. You clock in, you clock out, there's no overnight call. And really it's not so much about the responsibility as often it's shadowing, which is what much of their preceptorship really is.
Well, and people are dying. So again, it's not even that, the only reason we're talking about the fact that these hours are so different, like Rebecca mentioned, is because as a result of having 1,000 hours versus 15, and actually Rebecca and I had 20,000 by the time we came out into practice. So that difference is actually killing patients. So again, and it's killing children. I mean, this 19-year-old girl, I go back to Alexis Ochoa, Dawkins, and it was heartbreaking to read her story. And it's so appalling what happened. I mean, and you can watch it happen over this 12-hour period, and it would not have happened if there had been an ER physician in that ER. It's just plain and simple. I think anybody that's been to medical school and residency of any kind would know birth control pills, chest pain, low oxygen is a pulmonary embolus until proven otherwise.
Yeah, so for those who don't know the story, it's in our book, and it's one of the stories that we weave through the book because it presents so many examples of where things have gone wrong. And the story is that there was a 19-year-old college honor student and a basketball player. She was an athlete in perfect health. One day she suddenly got short of breath. She had chest pain and she fainted. Her boyfriend called 911. They brought her to the ER. Not in a rural area, just outside of Oklahoma City limits, but the only person on staff was a family nurse practitioner. There was no physician even there in the emergency room. The nurse practitioner treated this patient, or tried to, for 11 hours, never once called the supervising physician, and never correctly diagnosed her with this blood clot in her lungs. She finally transferred the patient when it was clear there was nothing that she could do to get this girl better. She didn't have the right diagnosis. By the time she got transferred to a tertiary center, she died. And
the reason,
went to
sorry, I was going to say the reason she was transferred, by the way, was because the nurse practitioner cardiologist that she happened to call, who wasn't her supervisor, said, get a chest CT. She didn't even know why they'd ordered that chest CT. And she said, oh, well, the patient has a crushed sternum. So we got to just send him elsewhere. Didn't even have the diagnosis right. Sorry, Rebecca, keep going.
No, that's right. Well, what happened was the nurse practitioner had the hubris to go and look at the CT scan. And I'm a family physician, and I read the chest CT reports that the radiologist who did a residency for 5 years reads. I don't have the hubris to say that I'm a radiologist, but yet we are seeing this among non-physician practitioners. They think that they can do every specialty. And in this case, she went and read the CT herself and said, oh, I see the problem. The patient has a crushed sternum. Meanwhile, there was no mechanism of injury for that to happen. It was completely outlandish. So they transferred her. They accepted the transfer. But of course, by the time the radiologist called and said, this patient has bilateral massive pulmonary emboli, then the patient was already on the way to the larger center, where she did pass away within just a few hours of arrival.
Yeah,
You're giving me chest pain. Oh my God. You're
Well, I
giving
think
me
it should
chest
give
pain.
chest pain to anyone who's a patient, because this young woman had no idea, nor did her family, that she was not being treated by an emergency physician. They were under the impression, it came out in the deposition, that this person introduced themselves as a physician. They were wearing a white coat. And so they made an assumption, and you don't know, you're a patient. We wouldn't know even when you're ill or you're in distress. You just trust that the person taking care of you, that you're putting your life into their hands, that they're properly trained and they've been credentialed, and that they're going to do everything they can to help you.
Rebecca, you just touched on the thing that I find it the most striking and the most scary. It's the most frightening, is that when you're there, you're helpless, you're vulnerable, you may be in an extreme emergent situation. You're not thinking about, is this a doctor, is a nurse, what kind of variation of care am I going to get? I just want to know that you are the one that needs to take care of me. And if you're not, you're going to go get that person. You know, I have 3 family members I take care of. They're in varying levels of dementia and you know, abilities. And you know, when we show up at the ED, sometimes it's I need help and I need help now. I go with them, and I'm frightened enough that I go with them. I'm the nurse. I'm the lone nurse in the crew here. I do that because the biggest part of what I have to do is to interpret who just walked through that door. What are your credentials? What knowledge are you bringing? And do you belong here? That's what I do 90% of the time. And I really shouldn't do that. And in addition to that, you know, I feel for the families that don't have someone like me to be the interpreter. You shouldn't have to have that to gain care in our country.
You know,
And
don't
you
you think
shouldn't have to have that to have a doctor take care of you. So again, a doctor can be a PA. So a PA can have a doctorate in medical science, as we talk about in the book. So they can be a doctor. A doctor of nursing practice introduces themselves as a doctor. Yep. And then physicians introduce themselves as a doctor. And the argument is, well, we don't own the term doctor. Okay, we don't own the term doctor, but then the patient should know, are you a doctor of nursing? Are you a doctor of PA science? Or are you a medical doctor?
Or a witch doctor?
Or a witch doctor.
And I want to, I just want to underscore that, misperception among patients. And Rick and Des, I'll be interested to know if you've seen a similar sort of thing in your wound clinic. But I would often see people with chronic wounds, usually of the foot. And they come into my wound clinic and we do a workup. We find out that their A1C is in double figures, and they're just all kinds of comorbidities out of control. I ask the patient who their primary care physician is, because I want to talk to him on the phone and let him know what I'm looking at. I mean, maybe this guy just hasn't been to his doctor for whatever reason. And then it turns out that this person is a nurse practitioner. It happened to me repeatedly. It was not a rare event, and they thought they had a doctor. Well, they thought they had a physician. And you know, it happened all the time. And
Randy,
these wound care doctors right here will tell you that the thing that stops wound healing in its tracks is out of control concurrent conditions, particularly diabetes. So, you know, that's my story.
Yeah, we definitely saw a lot of that. You know, what this kind of makes me think too in this discussion too. I think that I know as podiatrists, when we advertise or my colleagues advertise, you cannot misrepresent your degree or your title, your position. And I always make it clear to my patients too, you know, if they're in the hospital and I'm consulted, you know, and we always took the team approach. I mean, these patients are the ones that we would see in wound care are generally medical time bombs. They have so many comorbidities, but the team approach, so I come in, I'm Dr. Bell, I'm the wound specialist, I'm a podiatrist. I also do surgery, and, you know, will you be doing my surgery, Dr. Bell? It's like, yes, you know, depending on what it was, but, you know, I'll be working with your other doctor, Dr. So-and-so, he's this person or she's that, you know, whether it was a cardiologist, vascular surgeon, infectious disease, but, you know, they need to understand who's who. That's so important. And you can't go around pretending that you're something that you're not. And again, it's not a slam. There's a place for these, you know, for these other parts of medicine, allied health, but they're not the role of physician. I'm sorry.
You know, you would like to think you can't go around pretending, and if you're a physician, you certainly can't. It sounds like as a podiatrist, you can't. The board of medicine would come down on you hard, but it seems like that does not happen with nurse practitioners. I'll give you an example. In the state of Texas, there were 2 nurse practitioners with a clinic that was specializing in hormone therapy. Every guy that walked in the door, whether they had a normal testosterone level or not, got mega doses of testosterone. And they killed people. There's several young men in their 40s that died of cardiovascular disease that was found to be directly related to the overdose of testosterone. these two guys advertised themselves as testosterone specialists, hormone specialists, just on their advertisements. It took the board of nursing about 2 years to do anything about it. And it was only after a physician in our group, we're in a group called Physicians for Patient Protection, and we're all about looking out for patient safety. She actually drove herself several hours away to the state capitol, had a meeting with the board of nursing to light a fire under them to do something. It took them the longest time to finally sanction this guy. And so that's one of the problems, is that these professionals, in the case of nurse practitioners, they're under the board of nursing, which is stretched very thin. They have to supervise regular nurses, RNs, LPNs, and nurse practitioners. There's just not enough of them. And in many cases, they don't act. You know, the example we talk about with Alexis Ochoa, the nurse practitioner that cared for her, that was really responsible for her not making it, really nothing happened to her. The family sued the hospital. The hospital was, I think it was a $6 million lawsuit.
$6 million. Mm-hmm.
Yeah, and the hospital got in trouble because of hiring and credentialing an improper person to work. But the nurse practitioner walked away pretty unscathed. She actually moved to another state where they have independent practice. And last I checked, she was working in a hospital providing, quote, emergency services somewhere.
Oh,
she did finally get a sanction.
At the VA hospital.
At a VA hospital,
VA.
taking care of our veterans. She did finally get a sanction. It was a couple years after this event. And what she got was a 1-year suspension, a $1,000 fine, and she has to take some like 12 hours of coursework or something on, do better. And so this is the kind of things that you're seeing. And so we're seeing very little repercussions for doing things like misrepresenting yourself, for harming patients. And that's really what Niran and I worry so much about.